doctor in Colorado is pioneering a health clinic that provides quality medical care to thousands of uninsured children in rural areas. So what's his take on the nation's healthcare overhaul? Joining me now is Dr. Larry Wolk from the Rocky Mountain Youth Clinics. Doctor, thanks for being with us. Let's divide this up. Before we talk about potential negatives, let's talk about the good stuff. What is good in this new law that will help you and your services?
Well, anytime healthcare or the healthcare agenda can be raised in priority, that's good. I mean, there's so much in our society as far as competing priorities that it's a good thing when we all talk about healthcare. And anytime we can talk about ensuring more children, providing better access, providing better coverage, I think that's a good thing.
The Association of American Medical Colleges says the new health law will cause a doctor shortage of 160,000 by 2025. The American Academy of Family Physicians predicting we're going to have 40,000 doctor shortage over the next 10 years. Will there be a doctor shortage, especially in rural areas, which of course you serve?
It's hard to say at this point. I mean, anytime you increase access and provide more patients to the system, we really do need to make sure that there are enough doctors, nurse practitioners, physician assistants, any kind of healthcare provider to be able to meet that need. So I think that is a valid concern with the Rocky Mountain Youth Clinics. We're always concerned about making sure we have enough doctors and enough healthcare providers to meet the need.
Do you worry that a doctor shortage coupled with planned cuts in Medicare will result in rationed care hitting seniors most acutely?
It could, you know, again, it's a delicate balance. You want to make sure that we're balancing both healthcare access for patients with the supply of physicians and providers, as well as making sure that the quality of care is preserved as well. We want to make sure that people aren't being run through a mill, that they're really being provided a quality service by qualified medical professionals.
Our own Dr. Mark Siegel is a medical contributor, wrote a column recently. I want to quote from part of it. The kind of insurance mandated by the new law is too easy to overuse, clogging up doctors' offices and leading to more unnecessary tests and procedures ordered by the doctors who fear malpractice and are desperate for tort reform. Does he have a point?
I think he has a point, but again, it's a balance. We need to make sure that we're practicing good evidence-based medicine, and everyone, you know, has a role to play. The patients have a role to play as far as valuing the health and the health care that they receive. The physicians have a role to play. The hospitals have a role to play. The drug companies have a role to play. And I think, you know, you always worry about underuse and overuse, and this is a good opportunity for us to reevaluate and reassess the healthcare system and make sure it's meeting a good balance.
28% of Medicare patients looking for a new physician were not able to find one. And it's not just Medicare, Medicaid. It's even worse. Only 50% of doctors, roughly, in the United States will even take it. Does this new law make it better or worse?
Well, I think I'm hoping that it will help address it. You know, the Rocky Mountain Youth Clinics that I created 15 years ago was because children who were uninsured and who had Medicaid, which is public insurance, couldn't access the traditional healthcare system. They couldn't access public health clinics. They couldn't access private practice physicians. And this type of model I obviously believe in, which is a true private-public partnership that addresses both a potential shortage of providers as well as providing access for patients who are looking for good quality health care.
This law will probably be adjusted in the future. If you had one or two things that you could say to lawmakers from your vantage point that could improve it, what would it be?
Well, again, I think we have to keep things as simple and understandable and as easy as possible. Right now, there are so many moving parts. It's so complicated. I think, you know, less is sometimes more. And rather than make the healthcare system more difficult to understand, I think we need to try to make it easier for people to understand. So my advice to lawmakers is to really try and prioritize making health care easy and affordable, so that people feel like it's a win-win.
Dr. Larry Wolk, thanks very much for being with us.
My pleasure. Thanks for having me.